Welcome back, and we welcome Dr. Mitchell Mutter to our program today. Dr. Mutter recently joined Erlanger's new cardiology practice known as UT Erlanger Cardiology, which is located inside the Medical Mall on the Erlanger Baroness campus. Welcome to our program. Why is this group formed? Is it one of those things that's needed in today's practice of medicine?
Well, I think so. I think that Erlanger is a safety net hospital, and it provides care to the indigent as well as the wealthy. So we take care of all patients. I think the mission for Erlanger in terms of health care is pretty much like the mission for other hospitals, but we have a mission of teaching, education, and research as well. Our group was not formed to corner the market at Erlanger. Our group was formed to try to make it more feasible for all cardiology groups to practice at Erlanger. And my former partners, I hope that I get to see them as often as I did when I was a partner with them. But there are 10 or 11 of us.
And you were telling me this is kind of the thing that's coming in medicine, not only cardiologists, but other gastroenterologists, all others are forming groups, or the hospital is helping form groups?
I think all specialties. When I was chief of staff at Erlanger was without gastroenterology for a while, or without ophthalmology and urology, and all those specialties are critical specialties to a hospital. And what happened is that you find yourself short, and if your mission is indigent care, reimbursement is declining for hospitals. Hospitals have to be sure that they have a go-to group for strategic planning and taking care of all patients, no matter what patient comes in the emergency room. So I think we're well positioned for the future. In Nashville, St. Thomas Group was bought by Vanderbilt. In Knoxville, the Baptist Cardiology Group was bought. So it's happening, and 50% of the cardiology groups around the country now, or cardiologists, are employed by hospitals.
Good news for the patient?
I think so. I think it means higher quality and doing the right thing. There's certain things in cardiology that are lost leaders, so to speak, where reimbursement doesn't really cover the cost of the equipment. And if you look at the overall program, instead of just the individual program, the patient will get good care every time.
What about this heat and your health? Is that something we have to be aware of, particularly if we have heart problems or have had a heart attack?
Oh, I think it's enormous. The heat index gets above 80, which is a combination of looking at temperature and humidity, you start feeling uncomfortable, but when it gets above 90 and 100, it can be extremely dangerous to heart patients. Then you throw in other risk factors. A lot of our patients are diabetic. That's also cuts back on your own regulatory mechanisms for dealing with the heat. We perspire, lower our temperature. If you ever find yourself out in the heat and not able to perspire, then you're probably too dry.
Oh, really?
That's right.
So you need to head to an emergency room.
Stay well hydrated. Early things that happen is you get headaches, stomach cramps. Those are things you got to get out of the heat. Our heart patients should not drink alcohol outside in the heat. That's another risk factor for heat exhaustion and heat stroke. And
it really boils down to common sense in a way, doesn't it? But we all sometimes need nudging that way.
Well, I mean, I played college football, and I still think that I'm as good as I was back then. But that's not true.
We won't go there.
We won't go there.
All right, friends, if you'd like more information from Dr. Mutter, there is where you'll find the location, UT Erlanger Cardiology in the Medical Mall. There is a phone number as well as the website, and you can check it all out. Thank you, sir. Pleasure to have you with us today.
Thank you.
Now we're going to join Mr. Food in the kitchen because it's time for taco potato salad.